Hi, Tracy.
Hi. I just, I see that Duff is on here, and Duff, you must be so tired of hearing me talk about vaccine.
Tracy, I never get tired of hearing good news, so particularly in my world.
I feel the same way.
Yeah, well, it's
Hey,
good
Minister.
news. We got lots of good
Minister.
news.
So I'm sure, I don't know that many people would know this on this call, but Duff Montgomery was my very first deputy partner in government. 8 years ago now, I started with Duff in natural resources. We both moved around a bit since then.
And you may not know, Minister, but I've served for Duff twice. In different places, at different times.
Yeah. So Rick, I know we've got kind of our situation call organized that Dr. Strang is on, so he's going to be in a bit, and then I'll have to go off and kind of replace him.
Yep, no problem.
But I don't know if you want to get started yet, or?
Yeah, I think we'll get started. We're at 60, so there'll be more that join in, but that's okay. So
we might be a smidge disjointed because I can do the vaccine piece and then Rob will come in and talk about the case piece.
No problem. So thank you everyone for joining us. This is a great opportunity for our members and businesses throughout the Tri-Counties to hear directly from government on a number of pieces related to COVID-19. I'm not going to waste any time. I'm going to go straight into letting Zach introduce, and welcome everyone.
Thank you very much, Rick, and really appreciate the opportunity. As I'm sure everybody on this call understands, the situation right now with this wave 3 outbreak is very serious. This is the worst situation that we have faced since the pandemic began. We have the UK variant that's here that is transmitting rapidly. We do have community spread, as Dr. Strang has mentioned publicly in the capital region. But also, unlike last time, we have COVID now cases in every single region of the province. A big difference with this, some big differences with this, and comparing to the first wave, we're seeing much more quick spike in case counts. It's spreading more rapidly, and we're also seeing more hospitalization. Increased hospitalization, particularly with a younger, healthier demographic, in the 40s and up. So I just want to express to everybody that we've all got to do our part to keep this thing reined in. We all have to live like it's hanging over our shoulder, and remind ourselves that every single social interaction that you do have to have in your life, realize that can be an opportunity of transmission. So act appropriately with mask wearing, social distancing, and of course, please, I hope nobody's congregating right now. So the healthcare system is making adjustments to deal with the increased hospitalization and what the modeling is suggesting it could go to as well. So elective procedures are being canceled again. There are going to be some impacts in order for us to deal with this more emergent situation, and we're even preparing to go beyond hospital capacity if need be, if we're not able to get these numbers under control. We'll start, I think, as Dr. Strang had said, we're these numbers coming in are still pre-restriction spread. So we're hoping over the course of the next week to start seeing the numbers decrease, but we have seen the numbers go up pretty much every single day. And that's, of course, impacted businesses. Everyone knows the impact, particularly on small businesses, that these restrictions have. Deputy Bernie Miller is on the call here to help clarify any of those issues. But I know that people can appreciate the rationale for this right now, because the situation is very serious. The positive news that we do have is Nova Scotia is really punching above its weight on the vaccine front. Right now, we are vaccinating at per capita growth rate that is better than any other province. We've got I think close to we're at over 30% of our population that's been vaccinated. We've been adhering strictly to an age-based process, which other provinces are now starting to adopt, because it does allow us to vaccinate more quickly. And of course, age is the single greatest risk factor with this virus. So thankfully, 100% of our long-term care facilities right now that are government regulated have been vaccinated. Residents have been vaccinated. And that is going to serve us well. And also the age-based approach is another reason why we're seeing kind of younger people hospitalized right now. And we have Tracy Barbarick on the call today to go over any vaccination questions that people might have. And of course, Deputy Duff Montgomery is here to speak to a labor perspective. So it's a real pleasure for me to introduce all of these folks who have been warriors over the last year, working day in, day out, 24/7, 7 days a week, to help us respond to this situation. And all of these deputies, and Rob, of course, when he gets on, Dr. Strang, have been incredible leaders within government, and have helped ensure that we have managed this situation in a way that has been the envy of the world. So hopefully we can do that again this time around. But we really do need everybody on this call to ensure that your network of friends and families and everybody's doing their part, because without public buy-in to what we're trying to do in these restrictions, things can get bad in a hurry. So we need you. And with that, I'm happy to hand it over to Tracy Barbarick, I believe, who is going to give us a presentation on the vaccine rollout. I'm very proud of Tracy and her team. We were the first province to have a centralized booking system for vaccines, and we are now outpacing other provinces. And we're leaders in second doses, delivering second doses, and we're moving, as I mentioned, at a growth rate that exceeds every other province right now. And it's been tough to kind of weather the political pressure of deviating from our strategy and our plan, but the fact that we haven't is allowing us to be where we're at. And with that, I'll hand it over to Tracy right now. I do have to get on a call with Dr. Strang and the Premier, but I will be back here as soon as I can. So Tracy, over to you. And thanks so much, folks. I'll be back soon.
Thanks, Minister. I'm just going to pop a little slide deck up here, and maybe somebody could tell me when they see it.
Looks great, Tracy.
Yeah, good. Okay, so I'm going to do pretty rapid fire sort of update on where vaccine stands in the province, and then I expect after Bernie and others speak, we can do some questions. So this is really, we've got 5 models of delivery for vaccine. Our long-term care, really, which the minister had said we're finished 2 doses for all our long-term care facilities and our residential facilities for adults with disabilities, the larger congregate settings, those are, and the veterans beds, those are all done. And that was largely us supporting the staff of the facility by providing iPads, vaccines, supplies, training, all of that, and they largely vaccinated their own residents. Sometimes we augmented that with some pharmacy capacity. The second is the healthcare worker clinics. Those are largely wound down now because the healthcare sector that was identified for priority access is largely complete. We do see a little bump now happening for those that declined a vaccine in the early days for various personal reasons, and now they're revisiting that. So that's the positive sign of this awful third wave, is that it has, if there was any hesitancy in our province, it's largely been beat down by how vulnerable we are to this pandemic changing on a dime. The third is our centralized community clinic. So there's 10 of those across the province. They can do about 25 to 30,000 vaccines a week across those 10. Then the distributed provider clinic is our pharmacies and our physicians. Less physicians than pharmacies because we didn't want to interrupt primary care. So by having physicians re-gear their work all towards vaccine means that other primary care issues would be compromised, and we didn't want that to happen. So we're largely focused in the pharmacy capacity. There are some physicians that are also running clinics here and there on the weekends and that sort of thing. The last model is our outreach capacity. So the health authority has a number of these mobile vans that maybe some of you have seen for testing. We're also using them some for vaccine, but with this third wave, of course, those vans are needed for testing. So a little bit less of that happening than what we anticipated. But when we get through this third wave, we'll bounce back in. The other piece that's in that outreach capacity is we'll eventually have a home care model for those that are homebound. So there are, for somebody has an 85-year-old parent living in their house with them, and they are largely getting home care, and they are not able to get to a community clinic or a pharmacy. But frankly, that'll be sort of what I would consider batting cleanup. So our race right now is to get to population immunity as fast as we can, 70, 75, 80%, and hopefully it's going to be much higher, which so far indications are that it will be. And then some of those one-ofs that are scattered around the province are protected by having their home care workers vaccinated and their healthcare professionals vaccinated, and anybody that's coming and going in the house. And then as we get through that population immunity as fast as we can, then we'll get back out and pick up all those homebound sort of situations. So this is where we thought we were going to be. So an important message is originally when these vaccine developers were testing vaccine to get it to market as fast as they possibly could, they tested intervals of 21 days between doses because that's the shortest that they could possibly do it and still get some immune response. So they ran all their trials at 21 days with that big race to get to market. What they now know is 4 months between doses is equally as effective. So 21 days and 4 months is not the Cadillac is 21 days and the poor cousin is the 4 months. It is the evidence has all shown us that 4 months is equally as effective. So I know there's lots of talk right now, and the lobby to get priority access to vaccine has now shifted to get shortened intervals. But the best way to get this population covered and protected as a whole is for us to get as many needles in arms for first doses as we can. Everybody's got some coverage, and then we boost with the second dose. So there is lots of talk about whether 21 days is good and 4 months is bad. That's not where the evidence sits at all. 4 months is equally as good as 21 days and allows us to do a lot more for our population. So when it was 21 days between doses, you'll see way down in September was where we thought we would get to the 19-year-olds. With that shift to 4 months, it meant we're able to get the whole population moved up sooner. So this was our original phased rollout plan based on that 21-day expectation. When that changed, some of the things in the phased rollout no longer made sense. So for instance, we talked about originally large food processing plants. When we thought there were going to be 19-year-olds with no vaccine until the end of September, we wanted to get some of those done sooner. When we switched to the 4-month interval and it meant everybody can get a dose of vaccine by the end of June, some of those things started to shift. So that's Lauren's slide. It's exciting for me, but boring for everybody else. This is what has happened as a result of the ability to go to the 4-month interval. So you'll see that vertical line. It should be slightly to the right now because the last time I used it was a few days ago, but we announced on Monday that we went to 50 to 54-year-olds. And this with our supply projections that we have from the federal government, and of course it's all supply reliant, this is the pace at which we can work through the population. So you'll see by the end of June, the little black dot is the date at which we call people in so they can start to make appointments. And you'll see by the end of June, we'll have everybody in. That includes the announcement that was yesterday, the 12 to 15-year-olds was just approved by Health Canada. We factored them in because we knew that was likely coming. So there's 37,000 12 to 15-year-olds. It'll take us 3 days to get them done. So that's the pace that this is now moving at as supply increases. So this was our early supply figures. The important thing to note is we got 186,000 doses between December and the end of March. We've gotten 202,000 doses in just April. So that's the speed that that supply is increasing. So you'll see 300,000 expected in May and 500,000 expected in June, which has us at over 1 million doses in that April, May, June time horizon. So the supply is a moving target. I will not lie to you about that. It comes earlier, later, more, less. So you're planning in a horizon where that is different all the time, which is why we've made some policy decisions that we don't release appointments in the centralized booking system until the vaccine is almost being loaded onto the plane, because it is so variable that we have even once had vaccine that was on the plane and on its way here, and they turned it around and flew it back. So it is that much variation in this business and continues to be. So this is our vaccine in arms per day to date. So you'll see the increase, and then faces over top. There we go. When you go off to the right, we take a nice big increase there. Our biggest day was about 16,000 doses in a day. And then we take a decrease because our supply actually was a little shorter. We knew that was coming. That wasn't a surprise. It's all part of the projections. And then you'll see yesterday we were back up at 12,000 doses. So progress to date, the healthcare workers I mentioned, the long-term care group I mentioned, first responders, we've been calling in batches. So the idea was not necessarily that everybody else wait while we cover those off, but that we actually run those folks in parallel. So medical first responders, police officers. So we've been inviting them in batches of 1,000, and we always knew that some of them would actually get access by age before they'd be called in batches. So the messages go as soon as you get the chance to go. Our shelters are all completed in HRM, and then the other shelters in the province are being covered off in the next couple of weeks. Corrections facilities, the staff in the corrections facilities are being invited into clinics with a single-use link, and the inmates will be done on site this week and next week. And temporary foreign worker quarters, so just our larger congregate settings, so the bigger bunkhouses. If there's any barriers to getting those workers into a clinic, then we'll look at whether we should go on site and do them with one of the mobile vans. Important to note, you don't need an MSI number to book a vaccine. You do need to call the 1-800 number if you don't have an MSI number, because they do a bit of verification. All the provinces have agreed that we will not promote travel for the purpose of vaccine. So there's a couple of questions that need to be asked at the 1-800 number. So this is a snapshot of the province. The analytics we have on this would blow you away, right down to the postal code level. So I have access to a dashboard that I can look at whenever I want in largely real time to know what's happening across the province. The goal of this whole thing is to bring the whole province in age down together. So it's all designed, the number of immunizers, the vaccine that's moved around the province is all designed to bring everybody down together. So whether you're from Yarmouth or from Sydney, when we call in the 50-year-olds, you're all getting a chance to get an appointment. So you'll see central region is on the bottom. It's just that I took a screenshot so you can't see it because it wasn't scrolled down. But you'll see right now, for instance, that Yarmouth is at 27% vaccinated. This was end of day yesterday. And we've got the biggest range we have is Antigonish at 38. So as we factor out supply for the next shipment, we're constantly pushing and pulling to make sure that the whole province comes down together. So I know you occasionally hear some talk publicly about somebody got more than somebody else. I 100% guarantee you that's not how that happens. This is all carefully orchestrated to make sure that every Nova Scotian gets a vaccine in their home. And you'll also see the top part is the exciting one, and consistent with the cases. If you look up above in the top left, our 65 and above year olds are over 80% vaccinated, which is excellent population immunity levels. Our 75-year-olds are 91%. And you'll see to the left, as we move the ages, we opened up, for instance, to 50 to 54-year-olds on Monday, but their appointments are largely 2 weeks out. So you'll see each one of those bar graphs are changing every day with the population. The little blue bit is those that have had a second dose already. So in early days when we were at 21-day intervals, there's some folks that have already ticked off, but largely because our big volume of vaccines started in March, it's really 4 months out before we see large numbers of people getting their second dose. So the strengths of our system that the minister did a little hit on, so this orchestrated goal to bring everybody down together. You'll hear some provinces, parts of, and I won't sort of call out any of them particularly, but there's lots of issues with, depending on where you live, there's either good coverage rates in sort of one county and awful coverage rates in another county, because they haven't sort of managed this whole thing in this approach. You see some provinces have called in different ages based on where you live in the province. Our First Nations, our 13 reserves have been doing their own vaccine clinics since we first got vaccine. We supported them with all the gear and the training and all of that sort of thing, and they're working through their populations. We've run 5 specific clinics focused on those of African descent, recognizing that they've been traditionally underserved, and we wanted to make sure we had good access and trust and good vaccine levels for everybody in Nova Scotia. Our people with disabilities, our larger congregate settings, and then we've also had 13 clinics in day programs across the province where the residents of small options homes, group homes, and day programs were all invited in to get vaccinated, as given that a lot of that population may not choose to go to a large community clinic. We mentioned the corrections, we've mentioned the shelters, we've done some subsidy to the rural rides transportation network to ensure that anybody that needs it can get a round trip to their vaccine appointment for no more than $5. Our centralized booking system is really the envy of the world. It had an awful first day that I don't care to ever live again when the whole thing crashed and it all went sideways. But it's been continually uphill or up on the upswing since then. And we've gotten some notoriety because a reporter in Toronto ended up booking for her mother down here and drawing a comparison to booking for another relative in Ontario versus here. So she's written some articles about it. It's actually an Ontario company called Can Immunize, and they're using Nova Scotia as their prototype, and they've been fabulous with us, and it's a terrific system. Reliability is the other thing. When you book your first dose, you have an appointment already for your second dose. Many provinces have no idea when they're getting their second dose or how they'll know to get one or when they'll be called in. So this central booking system means if you got a first appointment, you got a second appointment. And the other thing is not releasing appointments before the vaccine is pretty much in the air, so we don't have to cancel large groups of people, which a lot of provinces have had to do. So this is a picture, just a screenshot of the online booking system. My house is in Fall River, so you'll see I just put in my own address, and it brought, it's quite old now, but it brought everything from closest to furthest away from me, and I can make my choice based on my own level of, am I prepared to drive a little further? Do I want to wait another few days and see if there's something closer? So it tells you how far it is and exactly whether there's appointments available. And you'll also see, we tell you what vaccine it is. So we're one of the few provinces that does that, so people can make their own choices based on their own research. So this is some of the headlines from our early days. Vaccine supply uncertain, Nova Scotia lags behind, system crashes, so it's a bad day. And then this was this morning on CTV morning news was Nova Scotia's booking system draws rave reviews from across the country, and that woman is the CEO of Can Immunize that was talking about what a tremendous project it's been in Nova Scotia and how much they've learned and how much we learned. Kevin Wilson is a national immunologist that is actively monitoring all provinces all the time for cases and vaccine. And this was about 3 weeks ago when he started to report that by a hair, Nova Scotia is currently the fastest vaccinating province in the country. So I will give it to you if you've only heard the early stories about Nova Scotia being last. We were indeed last. We built a lot of infrastructure to make sure that we could upscale this thing and move quickly and have reliable, predictable access to vaccine for Nova Scotians. And that's what we built. It took a little longer on the front end, but boy, it's going like gangbusters now. What can you do to help? Continue to practice public health measures. This is a very tenuous time for us, so all of us need to stay the heck home. Encourage our friends and family to get tested and to get vaccinated. We don't seem to have any great pockets of hesitancy. People want vaccine based on those numbers in the early parts of that bar graph. We are not worried about hesitancy. We are worried that we don't want to have pockets of people that are distrustful for various reasons, many of them highly legitimate. We want to make sure that we get information to people that need it, if it's really easy to get vaccinated and all those things, so that we keep getting uptake. And we'll continue to monitor the province. If we see areas that for some reason we don't see good uptake, we'll dig in deep when we're in that sort of batten cleanup stage and make sure that we've got good vaccination rates everywhere in the province, and continue to support this and be a little patient, because we'll all get there soon enough. I'm waiting for my age group, which is the next one, to get in there and get vaccinated myself. Okay, I'm going to pull that down. Okay, I don't know, Rick, if we're doing questions now, or if everybody's going to do their thing and then we'll do questions at the end, whatever works for you.
And let's everyone do their thing, and then we'll do questions at the end. Just looking to see if Dr. Strang is here. Mary, Emma, do you see him yet?
He has not joined yet, so we can move along to Bernie, actually, Deputy Minister Miller.
Yeah. Deputy Minister, if you want to take it away for the economic perspective.
Sure. Thank you very much. And thanks, Tracy. That does get more interesting every time. And stay the heck home is clearly the message, to echo the Stay the Blazes home message of about almost a year ago now. So thanks very much, Rick, for organizing this. And thanks everyone for taking the time out to check in. When we started talking about this, we weren't aware of how challenging the third wave would be. So it is timely to have this conversation. And typically having the information from Dr. Strang would occur before my comments, but I'll create the context from an economic point of view, but we'll hear from him on the public health restrictions shortly. But economic and business consequences of public health programs is what I'm here to talk about. And I can talk about some of the very recently announced programs, and my colleague Duff Montgomery is very involved in the workplace related issues. So any questions about that, I'll be deferring to him. It seems a strange time for me to say that Nova Scotia and Prince Edward Island had the strongest performing economy in Canada in 2020, but it's worth saying to make a point, and that is that good public health policy is good economic policy. Nova Scotia and Prince Edward Island in waves 1 and 2 had the strongest public health response. And at the time, we were kind of forecasting what it would mean for the economy. This time last year, to be really candid with you, we had very little actual data to support where our economies were heading. But as it turned out, all of the Canadian economies contracted to some degree during COVID, but PEI in Nova Scotia performed the best, and by a very significant margin. So Alberta, which historically we've looked to as a strong economy, they were 5 percentage points behind us in economic performance. Ontario was 2% behind, Quebec 2.5% behind, Saskatchewan about 2% behind. BC was probably among the closest to us, about 0.5 percentage point behind. But I say that in humility, because Nova Scotians don't brag, especially about our economic performance, but it does emphasize the importance of having a strong public health response. And it's really rooted in the question of consumer confidence. When you think of what it is that drives an economy, and small business and interaction in the economy is still done face-to-face in the market, and consumers need to be confident that when they're participating in the market, they'll be safe. So that's why I say public health and safety and the economy are not a trade-off at the macro level, and that bears some emphasis. So from the point of view of the entire economy, we are collectively better off with a very strong and very effective public health response. And we're in the middle of one now with this third wave, which is proving to be, as the minister said at the outset, more challenging because it transmits quickly, and it transmits even with moderate exposure, and it has, it appears, more significant health consequences quicker on broader group of ages. So at the macro level, good public health is good for business, but at the micro level, obviously there's huge impacts on certain sectors, very significant impacts on any sector that relies on face-to-face transaction of business, and many business models are designed just for that. Obviously, a restaurant within in-house dining depends on their customers coming in and interacting with each other, lounges, barbershops, tourism. There's a whole range of business models that the very foundation of the business model is to bring people together, and the way in which public health has to respond to a pandemic is to keep people apart. It's that human to human transmission in close proximity that causes exponential growth and transmission of the disease. So we've got this contradiction. The public health measures are needed to limit human to human proximity as much as possible. That's why only essential shopping is enabled now, and why people are strongly urged, as Tracy said, stay home and stay in your community as much as possible. That's necessary for the protection of the entire community. But it does have a negative impact on certain businesses that depend on proximity. So I think the Main Street type of businesses, the barber shops, the salons, the restaurants are the ones that are most heavily hit. I'll go into some of the programming that's available, and I think that's maybe where there are a lot of detailed questions will come up. But the federal government has responded strongly and effectively, in my opinion, from a policymaker's point of view, with some good programs. And the one that I think has the broadest reach to small businesses, including micro businesses, is the Canada Emergency Business Account. And if any of your members haven't, or anyone on the call, or anyone who's facing a cash flow crunch because they are constrained in their ability to sell their goods or services during this latest lockdown, and they have not yet availed themselves of the Canada Emergency Business Account, I think that's the go-to program for speed and for a fairly significant injection of cash. So the way CEBA, Canada Emergency Business Account, works is it's offered through financial institutions. So most credit unions and most banks offer the CEBA program. It initially was structured as a $40,000 interest-free, partly forgivable loan. And it's interest-free until December of 2022. And it's forgivable. 25% of the loan is forgiven, so it becomes in effect a grant of $10,000 if the outstanding principal is paid off in December of 2022. So it was designed to put cash in the hands of small business owners so that they could withstand the shutdowns and lockdowns that were going to occur. It obviously is not a long-term loan with a December 2022 due date. That hopefully will be looked at again by the federal government. Right now, that's the due date, and there's no interest. Now, small businesses don't want to take on too much debt, and we get that, but this is a tool that addresses the immediate crisis. In addition to that program, there's the Canada Emergency Wage Subsidy and the Canada Emergency Rent Subsidy. And the rent subsidy pays a premium when there is a lockdown in place, as there is in Nova Scotia. I won't get into the details on those programs. They're the federal programs, but I did want to put the provincial programs in context. The way in which provincial programs have been designed is look at what's available nationally and then fill in gaps or create special programming when there's a specific public health order that affects businesses. So just a couple of days ago, on Monday or Tuesday, Minister Kasoulis, the Minister of Inclusive Economic Growth and Finance and Treasury Board, announced the Nova Scotia Small Business Impact Grant. And this is a grant program for those businesses that have been ordered to be either closed completely, like barbershops and hair salons, or materially closed or constrained, like restaurants that had to go to takeout only, or small retail that has to not have customers come in their business and they can only do curbside or online sales. So gyms and fitness establishments, hair salons, barber shops, spas, nail salons, body art establishments, they've all been ordered to be closed. The business model requires people to be face-to-face for a haircut, just as an example. Restaurants, no in-person dining, bars and licensed drinking establishments limited and closed, casinos closed, etc. So for those businesses, leave casinos aside because they're not part of this program, but the others that I mentioned, they're entitled to a small business impact grant during the current month, the month of May, and it will be determined based on a percentage of your typical monthly sales revenue. So if you were, and it's capped at $5,000. So if you were doing sales of $10,000 a month, 15% of that would be $1,500. That would be the value of the small business impact grant. The months that are used for benchmark are February of 2020 being the last kind of complete month before the pandemic, or April of 2019, which was a parallel month to the one that we had a closure where there was no pandemic in place. And if you were a new business that has started since March 15th, when the declaration of the pandemic occurred, then you can pick which month you want to use as your benchmark. And so the threshold is you have to have had a loss of revenue from sales of at least 30%. But if you get over that threshold, then you're entitled to that small business impact grant. And I can deal with any details in the questions. The second program that's being rolled out that's directed at small business and many of the same small businesses, and this one is stackable, so you don't have to choose which one. It's called the Small Business Real Property Tax Rebate Program. And it's a rebate on for businesses that own their premises. It's on their real property tax that they've paid. And for businesses that lease their premises and pay a proportionate share of the taxes to their landlord, they can get a rebate on the share of taxes. And it's 30% of the commercial real property tax paid for the final 6 months of 2020-21. So municipalities' calendar year ended March 30. Most small businesses have already paid their real property taxes. You can get a rebate of 50% of that last 6 months of real property taxes by submitting an application. Applications for that program will be open in mid-May. I think May 19th is the date. It could be the 17th. I'll confirm. But that program will open up fairly soon. The Small Business Impact Grant is opening this week. Many businesses have already collected a Small Business Impact Grant when the pandemic started. Those businesses will have an accelerated application process, won't have to demonstrate revenue loss that's already been established. Essentially, it will be confirmation that you're still in business and you seek the grant, and a fast-paced payment will follow. For new businesses that haven't previously participated in the grant program, they'll have to demonstrate the loss of revenue from sales, what their typical revenue from sales are in order to qualify. In addition to those three programs, there's a third one, which is the Tourist Accommodations Real Property Tax Rebate Program. It operates very similar to the small business program, but if you're an inn, a bed and breakfast, a hotel, a motel, if you have a registered Airbnb property that's assessed at the commercial rate, so therefore you're leasing out more than 4 units as a short-term rental property, those businesses are entitled to a tax rebate on their current real property taxes that would be the first installment of the current year. The final thing is for small businesses that have any provincial fees, so workers' compensation, which my colleague Duff is familiar with, or liquor license fees. Hairdressers sometimes need a fee for cosmetology. Any type of fees, similar fees to that, can be deferred until June 30th of 2021. So the idea is small businesses should be holding on to their cash. If they have a fee that's falling due to the provincial authorities between now and June 30th, they can hold on to their money and not pay it while the restrictions are in place. So I'll pause there, Rick. I don't know if Dr. Strang has joined us yet, but certainly happy to deal with any of the questions that could arise.
Certainly. So what we will do is I want to thank everyone for sending in a number of questions ahead of time with your registration. We're going to try and get through as many questions as we can today, as many as time will allow. But I do want to note that if there are questions that do go unanswered, we will certainly be connecting with Rick. We have notes of them all here, and we will be addressing them after the session. We are, Dr. Strang, as I'm sure you all can appreciate, tied up at the moment, but he'll be joining us very shortly. So what I propose we do is there are a number of questions related to our vaccine program, as well as some questions that Deputy Ministers Duff and Bernie Miller will be able to address. So while we are patiently waiting, we will get right into those if that's all right with everyone.
Yeah, let's do that.
Great. Tracy, I'll begin with you. And the question is, at what point will our Pfizer and Moderna vaccines be made available to individuals in their 40s?
If you give me 1 second, I will literally give you the projected date because it's up on my wall.
Awesome.
So we'll be expecting to go to 45 and upward very soon in the next few days. And then 40 will be right on the tails of that. So by the end of next week, we should be at 40 plus. All that's supply contingent, just because I am very mindful that things change on that front all along. But based on our projections, we should be through the 40s in the next week and a half.
Thank you. Thanks, Tracy. So the next question, Deputy Minister Miller and Montgomery should be able to field these. So the question is, a number of businesses in Nova Scotia are micro businesses. So they have 10 or fewer employees. Most of them do not qualify for the previous small business supports offered by the province. Those businesses who cannot apply until May 19th risk falling through the cracks because of the 15% revenue. Up to $5,000 would only provide $1,500 to $2,250. That's not enough to support these micro businesses. What more can be done for them at this time? That's a long question. I apologize. You're just on mute, Deputy Minister. So
this is the type of business that would benefit from the Canada Emergency Business Account. I know in the first wave, there was a lot of not confusion because it was being literally policy on the fly, but there was some question of whether the business needed to have employees in order to be eligible for CEBA. And the original rules were that you would need to meet a threshold requirement of employees. A lot of micro businesses, it's owner operated. The owner themselves may not be taking their income in wages. They may take it as dividends. So the CEBA was adjusted to make it available for a broader array of businesses. So the first stop, if not already used, would be the Canada Emergency Business Account. The other point, and I'm mindful of the fact that businesses don't want to take on debt, especially in times of uncertainty. But in the face of current circumstances, there is, through the credit unions in Nova Scotia, the Small Business Loan Guarantee Program. and it's a provincially guaranteed loan guarantee. It does attract interest, so the CEBA is more attractive. But if the CEBA is not available, then the small business loan from a credit union may be a line of credit that you can draw on as needed rather than taking a loan, maybe an area to explore. The Small Business Impact Grant has been tied to those businesses that have been ordered closed. So the list that I went through, restaurants and personal services, et cetera. If the micro business is one of those, they should be entitled to the Small Business Impact Grant. If they've been ordered closed or materially constrained, doesn't matter how large or small you are. If you're operating a hair salon out of your basement, you're still entitled to apply and receive the Small Business Impact Grant, 15% of typical revenue from sales. If you're a business that's not within those categories, but the nature of your business is it's just dried up because everyone's complying with the public health orders. So an example would be a caterer who doesn't operate a restaurant, doesn't operate kind of a for public dining area. A caterer may find that their business is dried up in this point in time. They're not under the scope of CEBA, a Small Business Impact Grant, but the CEBA might be beneficial in those cases.
Thank you very much. The next question is for ADM Barbara. And the question is regarding vaccinations and why public health has not prioritized the vaccination of public school teachers.
Yeah, thanks for that. There's been lots of discussion about all of those things. The fact is the single biggest risk factor, despite occupation, despite medical condition, is age. And the most organized, efficient way to cycle in 835,000 people for 2 doses of vaccine is to work through the age profile. So with the public health practices in place and the efficiency of rolling out a system so that every Nova Scotian got a first dose of vaccine by the end of June, segmenting out populations can really detract from getting it done as efficiently as possible. So certainly, and now with teachers with a little circuit breaker on the schools right now, we are tracking towards the end of June to have everybody to have a single dose in their arm, and it takes a couple of weeks for immunity to build up. So the response to cases, you can't chase cases with vaccine. It's just not fast enough response system. So those public health protocols become the most efficient way to shut some of that down and then get your whole population with a single dose of vaccine in their arms. Thank
you very much. Next question is for Deputy Minister Miller. And we agree the best economic strategy in this case is to get the pandemic under control. But we are hearing more and more about businesses on the brink of bankruptcy. And what would you say to those businesses? You touched on this in your remark.
Yeah, I suppose empathy for the challenging situation that the business is in, and the opportunity, if I can put it that way, every challenge is an opportunity to assess the business model. Some businesses have been able to pivot to online because that's the only way they can reach their customers. Collaborating with other businesses in order to come up with solutions are other things to explore. The sectors from the data I've seen, the most challenging sector is the tourism sector. And I know through the federal government, through ACOA and the regional development agencies, there's been additional resources put in the hands of ACOA for the purposes of addressing tourism. And it's a big part of our economy and a big part of the economy in Southwest Nova. That's the area where I think the highest risk is. And our ongoing collaboration within government with the federal government will be, how do we design programs to get people to the end of this pandemic? We are at a situation where, from Tracy's update, we know that end will arrive. We just don't know exactly when. And those businesses that have struggled through, we would be very willing, flexible, and desirous of collaborating with our colleagues at the federal government in order to make sure responsive programming is being developed. Because this is an economic shock that's driven by health rather than anything the business did. And I think it's incumbent on all levels of government to work collaboratively to try to find solutions for them.
Thank you very much. And one more question for Tracy, and then we will hand it off to Dr. Strang. Tracy, do you have any idea of the percentage of age groups that have gotten the vaccine so far? And what percentage are we looking for to achieve that herd immunity that we all speak of?
Yeah, thanks for that. So we're now, Nova Scotia as a population at large, the entire population, whether you're actually in the age group that's eligible for vaccine, you know, that 12 and above, but the entire population altogether, we're a little over 30% in the province. But through the age profiles, you would see that for those that have been coming in, we're actually in excess of 80% for every single age category that's already cycled through for their vaccine. So that's really, really tremendous indication of what we hope to keep up there. And if there's a silver lining to this awful third wave, it is, you know, an invigorated interest in vaccines. So we're hoping that will stay consistent through the age profile. As far as what's the magic number for population immunity, the virologists and immunologists would tell you there's not a magic shooting solution, and it depends on the actual virus. So you'll see the number that's spoken about regularly is 70%. We don't actually know what the precise number is. What we hope to see is 80% and above throughout the age categories. And then I think we're well covered off. And equally important will be that second dose. So some provinces you've seen start to, you know, or some states rather are reporting that people are tailing off for second dose. So we need everybody to remember the second dose is as important as the first dose to keep those immunity levels up there.
Thanks very much, Tracy. Dr. Strang, I will hand it off to you for your remarks.
Yeah, thanks, Miriam. Good afternoon, everybody. And I apologize for I was on the call with the Premier's office. So I know you heard some pretty stark and blunt news from the minister earlier, but I'll just reflect that we are in a very serious situation here in the province. Our numbers remain very high in Halifax. And the reality is that, you know, you probably heard about, we had a big backlog of testing in the lab. We've dealt with that, but public health has been overwhelmed, and our ability to take all the positives from the lab and start a case investigation and find even basic information on those cases is backlogged. And so the reality is that we have more positives than we're reporting from public health simply because of our follow-up. So I think the key message is that, and you'll hear more at the briefing tomorrow, that this is not just a Halifax issue. It's quite likely that there is virus in communities outside of Halifax. And even if there's not, we need every Nova Scotian to know that this is and understand this is a provincial issue. And we may or may not have virus in your community, but you have to act like there is virus there, because all the restrictions and everybody following the public health protocols, what that does is that even if the virus does show itself up in Yarmouth, if everybody is following the protocols and we have the restrictions, what that will do is prevent widespread in the community, and we can stay on top of things. But if anybody's thinking that this is just a Halifax-based issue and I don't have to worry about it because we haven't ever had COVID down in Southwest Nova, you need to dissuade yourself of that right now. This is a critically serious issue, and it's across the province. So the month of May is going to be tough. We're going to have to buckle down even harder. We're talking about putting even more restrictions at the border. Everybody needs to stay home, and this is a business crowd. We need your help. That if at all possible, your employees can work from home, you need to support them to work from home. We still have too many businesses where we're seeing office type work that people are still coming into the office. So part of the restrictions is you need to work from home wherever possible. And I know it's tough. We will get through this, but the month of May is going to be tough. This is not a 2-week lockdown. We're going to be locked down, and hopefully then this does is puts us in a position where we can start to reopen. It'll be slow and cautious like we did last time, but we'll start to reopen in the month of June. And that, along with our, you've heard from Tracy. Tracy gets to give you all the good news about how wonderful our vaccine program is going on, and I want to give her a shout out and her team. Despite all the criticism, it's remarkable what the progress and the success of our vaccine program. That is the longer term way out of this. So we have to lock down, get things back under control. The vaccine then gives us the population immunity that in a space where in June we can then start to, as we've got things under control, we can then start to open up the province in a safe way. And the high levels of vaccine uptake allow us to do that even in a safer way, and perhaps even a little faster. So we're still on track to have a much less restricted summer, but we got a lot of hard work ahead of ourselves for the month of May.
Thanks very much, Dr. Strang. I guess we'll get into some questions now, and again trying to get through as many as we can before finishing up. So one of the first questions here, Dr. Strang, for you is, what will have to happen in your eyes before individuals can come into Nova Scotia without quarantining? And that's both domestic from other provinces as well as international visitors.
So that's going to have to be, and this is something that will start to change as we get two things. We have to get control of the virus here in Canada. Until we have much lower levels of virus activity, even domestically, we're going to have strong border measures. The other piece of this is building up much higher levels of vaccination. At some point, probably in the summer, we can start to think about how we do differentiate and have less restrictions for people who are vaccinated versus not vaccinated. But that only really works when you have a high level of vaccine uptake in the general community. So a lot of this is two things. It's doing what we can to bring down the level of virus activity, and having the patience to allow our vaccine program till we get high levels of immunity in the population. So, to me, that's the earliest we can even start to think about that is the summer. And when I look around other provinces, it's probably is more like a fall type issue when we can really start to say, now we can be much more relaxed at our borders because of those issues around virus activity and vaccine coverage.
Thank you for that. Another question is public health still in need of volunteers to help out with vaccination clinics?
I'm going to defer that one over to Tracy.
Yeah, so we've had over 1,000 volunteers in the province. So that's been amazing. And we largely have what we need right now. Having said that, the little pin goes in if we get this, if this third wave, if we can't get this under control, the answer to that question will start to change, because of course the resources that we have in the vaccination system, we've had over 500 retired physicians, nurses, our LPNs come back just to vaccinate. But there is a reality where, depending on what happens here, you may need some of those resources elsewhere. So we've had, for instance, dentists and veterinarians and other professionals offer to participate in vaccination if we need them. we've also got the Canadian Armed Forces with reservists. So lots of people that would take more training to have them be able to vaccinate, but our staff complement in those clinics is equally immunizers and non-immunizers. So right now we have what we need, but that story may change. I hope not.
Thanks, Tracy. The next question is, how can we as businesses assist public health in contact tracing? Is there anything that businesses can be doing to assist public health?
So I think one of the things that's always helpful is if you have a list of who's coming in out of your business, some kind of a registry. So if we get an indication that person X was at a retail outlet, I'm just making this up, May the 3rd, from 1 to 2. What's really important to know is that who else was in that retail outlet, both staff and customers. I know that's easier to do when they're small establishments or businesses or other or than bigger ones, but whatever you can do, that's because then that information makes it much easier for public health to do. So one of the things that I know businesses don't like when we do these broad public notifications, because people often tend to then blame the business. The reason we have to do the public notifications is because that's our only way to reach people. Because we can't reach people, we don't have information on each individual to be able to contact them directly. So the more that we can get, and I have to say this, accurate and reliable, because some of the things we've had, when you let people fill it out themselves, you wouldn't believe, like in restaurants, you wouldn't believe the names and the fake names and clearly fake phone numbers you get. So something that we have accurate, reliable information that makes our follow-up much easier.
Thank you. And another outstanding question is related to mask wear. And the question is, how should we handle our customers who refuse to wear a mask, or an employee who refuses to wear a mask?
So I'll start with the customers, and we've said, legally you have to be aware of that there are some conditions, medical conditions, where people can't wear a mask. The reality is those aren't many. Those are few and far between. We have not set up a process for people to get a medical certificate because that's complicated and takes a lot of healthcare resources. So at the end of the day, we are relying on people to be honest and truthful about when they say they can or cannot wear a mask. And for human rights and other legal issues, we've said you can't deny somebody access to a service because you're in very a murky ground from a human rights and legal perspective. So what we've said to businesses, we've got our signs. I see many businesses using them. They're on our coronavirus website. Use the signs. Do whatever you can do to say to folks that if you can't wear a mask, you really shouldn't be coming in here. But at the end of the day, if somebody insists, then I think you have to just allow them. For employees, I think you might want to have a discussion with a lawyer around that in terms of what's your right as an employer-employee relationship. It's a bit more complicated there. And it's one of the reasons why many of the retail, we're saying to many people as much as possible, work from home, or a lot of the retail places are shut down and only have online and phone ordering and then storefront delivery, which helps significantly right now with this issue.
Thank you. A lot of comments on that question, so I'm glad we were able to address that. This is a question, Dr. Strang, for you and Tracy.
Sorry, Mary Ann, there's one thing more on that last question. So there are some people who are very deliberate anti-mask advocates, and we've had this in some restaurants in Halifax where they're being clearly going in and they've been extremely disruptive, and it's clearly they're not there saying, I just can't wear a mask. If those circumstances, and we've communicated this to police, you should feel absolutely free to immediately call law enforcement on the very blatant people who are there to disrupt your business. And we've flagged that for police. You know, we don't want, you know, the person who whatever reason, the individual who says I can't wear a mask for health reasons and is not being clearly disruptive and stuff. We don't want law enforcement involved with them. But if there's somebody who's clearly there, their agenda is to disrupt your business and make a public scene, absolutely call law enforcement.
Thank you for adding that. This is a question about accessibility with regards to our booking system and our communication. The question is, has public health communicated with specialists to ensure that our booking system and our instructions on how to book vaccinations and testing is accessible? So some examples are clear infographics, plain language, those kinds of things. Who have you engaged, and what has been the outcome of that?
Yeah, thanks for that. So we have produced a number of one-pagers that have been plain language through our plain language team for information around vaccines. So, and we've also had them translated into multiple languages. So we have done that. And we actually just had last week an accessibility team do an assessment on our online booking system. I haven't seen the results of that back yet, but I expect that we'll get that soon. I must say, in the early days of, you know, we found out on December 8th that we were getting vaccine on December 15th, and we hadn't even yet seen the drug moniker that tells us the details of the vaccine or how it needs to be stored and all of those things, and then getting a bunch of infrastructure stood up. I wish I could say we had that accessibility assessment done before now, but we hadn't. We just had too many things to get up and running, and so now we're adding that layer on top of that to make sure that we make that as easy as possible. The 1-800 line as well has continued. They do full translation for language barriers, and they have also continued to add staff to that system so that wait times are short. I think last I talked to them, their average wait time was 8 minutes. So that people that needed to talk to somebody to help navigate that system could do it. And then the 811 operators or the 1-800 line operators actually use the same system that you or I do. It's just somebody that can help navigate some of that.
Thanks very much, Tracy. This is a question for Deputy Minister Miller, and it's regarding what is considered an essential business. And the question is why Nova Scotia has chosen not to, have businesses open, but section off aisles that are considered non-essential, and why that choice was made.
Yeah, I can address the question of essential, and then there may be more to say on this from Dr. Strang as well, but essential in the order is essential to the life, health, or personal safety of individuals or animals. So it's a very restrictive definition. It has to be put in the context of the fact that not only is the situation serious, but it's getting more serious. So the context is we don't want people to shop at all unless it's essential to their life, health, or personal safety of individuals and animals. If we then kind of introduce more of a subjective analysis of what is essential in individual cases, it's operationally impossible to actually enforce. To use perhaps not the best example, but I'll use it because it comes to mind. You know, some people for their health may need orthotic shoes and some people don't. So if you just said shoes are essential or they're not essential, then you're going to miss those distinctions. So it's really the context in which people should be receiving this message is those retail businesses that are able to have customers come into their premises. It's for those things that are necessary to maintain life, health, and personal safety. And the rules that applied in wave one apply with even more vigor now, which is it should only be one member of a family going in. Shopping should be limited, masks should be worn, social distancing should be maintained. I know these questions do get complicated because we start to get into dividing and assessing what's essential and what's not. And I think the context I just want to put it in is that it really has to be respected by both the retailers and the consumers, that we want them to stay home as much as possible. And the expectation is that what they're acquiring is truly essential. In other jurisdictions, they've tried to rope off aisles, and they've tried to cover things. It just hasn't been effective at all in terms of getting to the real objective, which is limiting the number of people in the stores.
Thanks, Bernie. We have 2 more questions that we can fit in. I am cognizant that we've run over time, so I do appreciate all of you who have stuck with us here. One last question for Tracy and one last question for Dr. Strang. Tracy, when do you think we will be able to vaccinate teenagers? You might have to run and check your chart again.
Yeah, no, I got it closer to me this time. I had to run across the room last time. So the Health Canada just approved the 12 to 15-year-old group yesterday. So we were ready for that. I expect that we will see 2 and up come as the next block. I'm not sure when, but what we've got planned is we'll just continue to tack the 12 to 15-year-olds on the end. So right now we're projecting sort of by the 3rd week of June, we would have that group in with everybody done by the end of June. So in our everybody done by the end of June, we had already factored in that 12 to 15-year-old group of kids.
Thanks, Tracy. And last one for Dr. Strang. It's a question about vaccinations. Can I require that all of my employees get vaccinated? And will we be mandating vaccination?
So we're not mandating vaccination at a provincial level. I think that's a very tricky area. You start mandating vaccination, and I would say that you should, if that's a road you want to go down, you very much need to get some good legal advice around your human rights, etc. That the position you're putting yourself in. I would encourage us to do everything we can to give people good information and support, things that a business can do. So are there barriers that your staff have? Maybe it's hard for them to get to a vaccine clinic because they're working. And so what can we do to facilitate maybe even giving them paid time to go get a vaccine? But what are the things you can do as an employer to support them going to our vaccine clinics? Would be I would say would be a far better place for you to put your time and attention, rather than worrying about whether you're going to mandate it or not.
Thanks very much. I'll hand it back to you, Rick. Thank you.
Thank you very much. I'm going to hand this over to Carrie to close us out.
Hi, thanks, Rick, and thanks everyone for attending today. I one point counted 96 attendees, so it's a wonderful turnout, and it just shows the level of interest in getting informed in our business community. I want to thank Zach for participating and being there. We're so glad we're in your hands right now in terms of your portfolio Minister of Health, and also as our MP. Thank you very much, Zach, for all that you're doing. Dr. Strang, thank you so much. Good to see you without a tie. You look a little more relaxed.
Unfortunately, working from home.
That's wonderful.
He's certainly not relaxed, though. I'll tell you that.
It's just the appearance of it. Thanks so much for your quick action on this recent lockdown. We've seen around the country other places, take their time on these decisions, but I think it's such a wonderful move that you really cracked down on this situation quickly, and we hope we're going to see the results soon. And thank you so much for your time and being here today to assure us. And to Tracy, I can't imagine how your department even functions right now. You've done an incredible job. I know in the online booking system. I was talking to my brother in Ontario, and he went on a cumbersome system, waited an hour and 14 minutes in a lineup for a vaccine that he was booked for, and couldn't be told what vaccine it was until he sat his butt in the chair. So it's remarkable, the system that you've put together so quickly, and we're really, really appreciative of that. And your results today are really showing that it's working, and also that the that you stuck to the age of, vaccinating by age. I know, Dr. Strang, you took a lot of flack for that in the media, but it really seems to be working and the results are proving themselves. And thank you to the 2 deputies that were with us too. That information, Deputy Miller, is so fluid and changing, and it's very cumbersome for some businesses to, navigate this, but we thank you for the work that you're doing there. So thank you so much to everyone for attending today. Stay home, stay safe, and thanks again.
Thank you, everybody. Thank you for your support and your ongoing commitment.
Thanks, folks.